There was a time in Nigeria when hand washing was practiced religiously. Hand washing bowls and sanitizers were seen in all public places like schools, banks, and eateries. I'm sure you remember, yes, the Ebola saga. But when Nigeria fought and won the battle against Ebola, this healthy habit disappeared. Hello and welcome to your informative health program, Health Business. I'm your host, Oluwatoyin Kolawole. On the program this morning, we'll be taking a look at the re-emergence of Ebola virus in the Democratic Republic of Congo and what Nigeria needs to do in terms of emergency preparedness. Our experts on the program will educate us on what Nigeria needs to do to combat this virus once again. But first, let's watch this short documentary. Stay tuned.
The government of Democratic Republic of Congo has recorded another outbreak of Ebola. The country made an announcement after 2 cases were confirmed by a laboratory in Kinshasa. The Center for Disease Control and Prevention are working closely with the Ministry of Health and Population of the Democratic Republic of Congo and other multiple partners such as World Health Organization to investigate the outbreak, which started from the Bikoro region of Equator Province in the northwestern part of the country. These agencies have identified priority areas of support such as establishing an outbreak response platform, implementing surge support for deployment of personnel, supplies of laboratory materials, operational and logistics support, and identifying communication needs to support the response. You will recall that in 2014, Democratic Republic of Congo experienced Ebola outbreak that claimed so many lives. Now that the outbreak Ebola has resurfaced in Congo, how prepared is Nigeria?
Joining me on this program this morning to discuss the re-emergence of Ebola outbreak in the Democratic Republic of Congo is a public health analyst, Dr. Tuyi Mebawandu. You welcome on Health Business.
Thank you.
Some weeks back, we had the news that Congo had the re-emergence of this deadly disease, Ebola. Why do you think this came at this point in time?
Well, let's be mindful of the fact that DR Congo is the epicenter or ground zero of Ebola outbreak. The disease was first discovered in DR Congo as far back as 1976, and from 1976 to this time, we've had as much as 30 outbreaks, 9 of them in the Democratic Republic of Congo. And then even after the very disastrous experience in 2006, West Africa sub-region, the DR Congo had at least 3. This is the 3rd outbreak, even after that. So we can say that in DR Congo, the epidemic is simmering, and we then have spikes occasionally. Of course, why is the spike? One, we appreciate the fact that the DR Congo has a very weak health system. And secondly, poverty is on the rise in that place. And then the health structure is very weak, and then people are not, even at the level of WHO, we are not seeing that, requisite response in terms of stemming the epidemics through proper surveillance, through proper continuous education, through continuous interaction with the locals, especially those ones that are coming in contact with the reservoir of the Ebola virus.
Now that we know that Ebola is in Congo, How prepared do you think Nigeria is in terms of emergency preparedness in combating this disease?
Now, we've had an experience which the whole world hailed as being superb in terms of our response when they had the outbreak a few years back. We need to strengthen that. We need to actually put at the point of entry all specific measures to ensure that people, we screen travelers. Then we need to really improve the knowledge and the understanding of the general public in terms of hygiene, hand washing, and everybody should be on the lookout for any fever that is not responding to conventional treatment. At the level of the health facility, it's important that we need to embrace universal basic precautions. Proper sanitation, proper hand washing should really be instituted. Every case of febrile illness should be treated as a suspected epidemic, and as such, the basic things, the gloves, the face mask, and the barrier protection should be engaged in this regard. Now, the Center for Disease Control is doing all they can do because, again, let's be mindful of the fact that we have all sorts of epidemics, confronting us. We've just escaped that of Lassa fever. Meningitis is at the background. Then cholera is there. So it's important that the Center for Disease Control should be able to initiate a thorough process that will allow screening or surveillance, even at the local level. The key challenge for us is to be able to spot and stop the epidemic before it raises its head. And how do we do this? Because we know that as the human settlement increases, as we come in contact with those reservoirs of these germs, we're likely going to pick the germ and spread it to other people. So the appropriate thing is for us to be able to pick those germs even in those reservoirs, whether the wild animals, whether the bats, and be able to screen and know that, yes, this bat is carrying the germ, and then prevent the spread to human. Now, some of those activities that tend to promote the spread of epidemics in our society, yes, some people do eat bats, some do eat rats, some do eat monkeys and all the stuff. We need to be able to engage with those people and let them understand, even if they have to do that, the proper method of coming in contact with those animals, and then be able to screen at those levels. Now, if you don't strengthen the local understanding of these epidemics, we're still far away. So it's important, and for us, as much as the vaccine comes, we should be able to be ready to test those vaccines and see, whether we can achieve some mileage in terms of prevention of these diseases. So these are some of the key things we need to do. But more importantly, at the level of general population, we need to step up our hygiene, we need to step up our barrier protections and universal safety precautions. We need to step all those things up. That is what we can do. And then the government needs to continuously engage the populace on the risk we are facing. If we need to travel, we need to issue some travel instruction to people that are coming from some part of the West Africa or Africa that can probably bring those epidemics.
When Ebola came to Nigeria, people were seen carrying hand sanitizers in their bags. Some banks, all banks then had hand washing basins, they have hand sanitizers, even before you get inside the bank. But I think all this went away when we conquered Ebola. Do you think this should be so? Don't you think we should still continue these healthy hand washing habits?
Again, it's unfortunate that we tend to embrace adhocracy, ad hoc things. When a fire brigade kind of thing, when things happen, we are all on our toes. When the thing simmers down or goes down, then we return to our normal level. I think the campaign for sanitation, the campaign for hygiene should be a continuous thing that should be engraved in our psyche. As it is now, the major work will have to be with the local government, who is going to ensure that and ensure that people they carry out either in terms of health literacy campaign, either in terms of demonstration, either in terms of education of the people, to ensure that they continue the process of continuous healthy behavior so this is very important. Now, even at the individual level, because at the end of the day, when the thing comes, all of us are a danger. We should be able to standardize, especially in secondary school, in primary and secondary school, the practice of hand washing is very key. They are simple mechanisms, they are not expensive, there are simple precautions that we can take so that we don't really pick epidemics. Hand washing, and then every day we need to reiterate and let the people understand the risk they face if they don't embrace good hygiene practice. And some of the visual we see on our billboard, we need to change them to tell us Ebola is back in Congo. We are also at risk. All it takes is for somebody who's infected to fly into Nigeria and then be entered into our market and spread the disease. So we should also be mindful of that. And in another thing, we know that quite a lot of people do trade with Nigeria from Congo. We cannot issue a travel ban outright, but again, we have to be cautious and then raise the travel advice, and then at the airports specifically, look out and then be able to cooperate with the health department in Congo, the DR Congo, to help so that all of us can work in tandem to prevent another outbreak in West Africa. Now, fortunately again, Jesus, who is the WHO Director General, is from Ethiopia, South Africa. We are looking at leverage in that regards to be able to stem some of the tides of recurrent outbreak, especially in Sub-Saharan Africa. So, having learned some lessons, having caught the support of the WHO and international organization, I guess we may not really have the kind of outbreak we experienced in West Africa in the past few years.
Thank you so much for being part of Health Business this morning. And I'm sure that government too is working assiduously to ensure that we don't have a re-emergence of Ebola in Nigeria. Thank you so much for being part of the program. It's important that governments at all levels strengthen emergency preparedness so that deadly disease like Ebola won't find its way back into Nigeria. Next on the lineup is Mother and Child.
In children, teeth should be cleaned as soon as they emerge. By starting early, your baby gets used to the daily routine. A soft washcloth wrapped around your finger can substitute for a brush when teeth first appear. Ask your dentist when you should switch to a toothbrush. Some dentists suggest waiting until 4 teeth in a row have come out. Others recommend waiting until the child is 2 or 3 years old. Here are some tips to taking care of your child's teeth. Choose a small, child-sized, soft, bristled toothbrush. Soaking the brush in warm water for a few minutes before brushing can soften the bristles even more. The American Academy of Pediatrics recommend using an amount of fluoride toothpaste the size of a grain of rice as soon as your baby's first tooth appears. You can graduate to a pea-sized amount when your child turns 3 years old. Brush your child's teeth twice a day, in the morning and just before bed. Spend 2 minutes brushing, concentrating a good portion of this time on the back molars. This is an area where cavities often first develop. Replace the toothbrush every 3 to 4 months, or sooner if it shows signs of wear. Never share a toothbrush with others. After your child is 6 years old, a fluoride rinse can help prevent cavities. Ask your dentist which product is right.
It's time to join Dr. Olatunji Nasir on Vet 360. Don't go away.
Hello viewers, you are welcome to another episode of Vet 360. Let me cast your mind back to what we discussed last week. Last week we talked about what is a pet, why you need to have a pet, and what qualifies you to have a pet. Today we are taking the discussion a bit further on how to care for your pets. Well, I said last week that you have to resolve to have a pet, having been qualified to have one. But how do you express that love? How do you show that you are a responsible owner? Today I'm going to be talking about the issue of responsible ownership. Because in order to care for your pet, you must be utterly responsible. Now we're talking about pets. Be it dogs, be it cats, be it rabbits, be it fish, anything you consider as pet. It was a conscious decision that you made that you need to have that pet at home. And then we talked about you considering that pet as a member of your family. Because if you do not consider the pet as a member of your family, there is no way you are going to be able to care for that pet as it should. So, like we said last week, the pet must also be budgeted for in the family finances. So that is very key. Yes, let's go to the broad topic of how to care for that pet. I will say it in several segments. What is key and paramount is the responsibility that you have towards that pet. Do you love your pet? It's a question I need to ask you. Because if you love your pet, there's nothing you won't be able to do for that pet. You provide good housing. And when I say housing, I do not mean those outdoor kennels. Of course, some pets qualify to be put outdoor, but with a lot of love to be dispensed. But I will also, my advocacy is for you to be able to have your dog in your house, within your household, if it's possible. That is why you have to have a pet. Let's use dogs as an example. They are readily usable here. It must be a dog of the size that you can keep in that house. If you live in a flat, I will not support you having very big, boisterous dogs. I will support you having the toy breeds. But if you live in a whole house, maybe a duplex, a detached contraption and all that, you can have your dog with a lot of compound, and then the dog can be able to play around and all that. But if you live in a flat, I will not advise that. So good housing is very important. And then where the dog would be in the house must be where the dog can be free from all sorts of problems. The place must be very dry. It must not be wet. It must be very cool. There must not be heat. You know, it must be a place that even you can sleep. Even you can stay. Dogs are not supposed to be considered, or pets are not supposed to be considered as anything that we can just give to anywhere and let them stay anywhere. No, it's not right. So housing must be very adequate. A lot of Nigerians will say, what is he talking about? But that is the truth. The truth is you must be able to keep your pet in a place where you yourself can sleep. And I won't say more than that. So it has to be, you can interpret it to mean anything. Then the second thing is feeding. Feeding is very, very important. A lot of people they will use thousands of naira to buy dogs. Some people even use dollars. There are dogs that will go for like $2,000, $3,000, $4,000, $5,000 a puppy. And then they have that puppy bought with so much money, and they don't want to feed. They want to be given all sorts of things. Some people buy, well, I hear they buy noodle waste, you know, they give bones, they give all sorts of things to their dogs, table leftovers, and some even allow their dog to scavenge in the compound and on the street. Whereas you can buy decent food. Some will go to eateries and then be taking leftovers that people have put a lot of saliva, a lot of corks, a lot of toothpicks, and all sorts of things. No, that's not the way to feed your dog. There are dog rations available all over the country. There are even decent food that you can also make yourself, homemade. So you must be able to have that wherewithal, that time to provide for adequate food at all times. If your dog will eat 3 times a day, so be it. If it's going to be 2 times a day, so be it. And that's it. And then again, it's about medicals. You must be able to visit the vet to tell you exactly what your dog will need or your pet will need for its medicals. It is also very, very important that your dog has to be kept, with all its vaccinations, the deworming, the everything, has to be perfect. And then preventive medicine is also very important. Then another thing before I finish this topic, because we are still going to continue next week, is that you must be able to allow a pet to express its innate character. A dog must be a dog. A cat must be a cat. The dog will snuggle with you. It wants to be your friend. The cat wants to be on its own. So you have to allow all those kind of characters for them. Until next week when I come again in the series of discussions we are going to be having on Vet 360, I remain Dr. Olatunji Nasir.
We've come to the end of today's episode of Health Business. For advert and sponsorship, please call the number showing on your screen or send a mail to us at goldbandinbox@gmail.com. My name is Oluwatoyin Kolaole. Join me again next week for a fresh package. Remember, living healthy is a serious business. Until I come your way next week, bye for now.
you